Well, you want it, you got it. Dr. Joel Wallach, one of the top researchers in his field, joins us. He is a true trailblazer. He doesn't like talking about himself, but I'm going to make him do it. He has defeated the FDA repeatedly. I've had other researchers and news people on, and they've said, you didn't know Wallach's the guy that helped sue and get law put in place to defend the right to buy vitamins, minerals, and things. I mean, I knew about that famous ruling and that act, but I didn't know that Wallach was involved. Went and looked it up, sure enough. There he is on screen, and he is a truthaholic like I am. Travels all over the country and the world, Australia, you name it, exposing what's happening. Dr. Wallach, tell us about your victories, your awakening, what you've done, and then I want you to get into what this big healthcare ruling means and what we're facing with this medical mafia run by the big insurance companies.
Well, thank you so much for all the kind words, Alex. And again, kind of following up on our show earlier today, the Flexner report back in 1914 set all this in motion. This is when the government began to take over medical care. This is where the big corporations like the Rockefellers actually took over medical care. Well, that was a huge mistake from the standpoint of American health, because the pharmaceutical industry, insurance came along not too long after that, and that combination of the pharmaceutical industry, which with the exception of antibiotics, Alex, most people don't know this, with the exception of antibiotics, which can cure throat or gangrene in your leg, bacterial pneumonia, with the exception of antibiotics, there's not a single drug out there that cures any disease. All other pharmaceuticals, all other drugs, over-the-counter and prescription, only treat symptoms. There's no law requiring a doctor to cure you, Alex, when you're sick, even if there's a cure available. And so it's incumbent, it's actually our responsibility to know these things like Grandma used to know. So this is why my wife and I wrote all these books, was to try and get the information out. We actually sued the FDA out of our own pocket 8 times in federal court. We prevailed all 8 times. And many of them had to do with birth defects of things like folic acid, preventing spina bifida and other neurotube defects. We'd known that in the animal industry.
By the way, I looked this up when I heard this a few years ago, but I didn't look it all up. I looked up more now. It's all true. You're one of the only people to ever beat them, and you beat them over and over again. So much of the health freedom we have today is because you took action.
Well, it's true, and I thank you for bringing that up. Again, I appreciate your support on that. This is so terrible that all these kids were being born with these birth defects like spina bifida, Down syndrome, cerebral palsy, heart defects, missing limbs, hernias, every kind of facial thing you can think of, cleft palate, cleft lip. These are totally preventable. Cystic fibrosis, muscular dystrophy, both of those are not only preventable, Alex, they're even fixable after the baby's born. In fact, I received an award last year in 2011, an international award for discovering the cause, prevention, and cure of cystic fibrosis, actually discovered it 35 years ago. It's actually a little belated reward, if you would, recognition, but I've finally got it out there, and we're going to have a lot more coming up here, so the general public will realize we can actually prevent and reverse cystic fibrosis. We're actually able to reverse the genetic markers, so we know it's not a genetic disease. And of course, muscular dystrophy is another one. And here's a case, and I actually had this confirmed 2 days ago. My theory was that we've been sending Jerry Lewis for 2 years emails and hard copy of the kids we're curing of muscular dystrophy. And last year, Jerry Lewis was not the host on the telethon for the first time in 22 years. Nobody said anything. It's just, Jerry's not here, that's it. He was literally sent on a cruise, so nobody could ask him anything. And they said, oh, he's sick. Well, no, even on a deathbed, he'd be saying, take care of Jerry's kids, right? And it turns out that they fired him because he brought all my data to the medical committee, and they said, hey, Jerry, this is just months before the telethon, and we won't make any money if people realize there's a cure, so you're fired. They fired Jerry Lewis because he brought the medical committee my data, and they just made a clean sweep. They fired everybody in the Muscular Dystrophy Foundation who is loyal to Jerry Lewis just in the last couple of months. And this year, they're only going to have a 2-hour telethon instead of a 24-hour telethon. And it's all going to be pre-recorded so nobody can interrupt it.
By the way, this is a big news story, and I have no doubt it's true. But I mean, how did you learn about this? Because we need to get a story out on this.
Okay. Well, I actually theorized that because we had been sending him all this data. And his personal assistant said how wonderful this was, and Jerry was excited. And I said, look, we're not looking for any money from the Muscular Dystrophy Foundation. We were looking for just Jerry, give him the opportunity to make the announcement. After all, you know, everybody in their own mind knows that muscular dystrophy kids are Jerry's kids. And I thought it was only fair, even though we had made the discovery, we thought it was only fair with all the efforts he'd put forth for 22 years. It was only fair that he was given the opportunity to make the announcement that the cure had been found. And so we'd been sending him all this data, and then suddenly he's fired. And so it had to have, so I guessed it. Well, just a couple of days ago, I called his personal assistant and asked, I said, okay, I'm theorizing this. I've been saying this. This is my belief over the years. And she said, yes, you're quite correct. And she was the one who volunteered that the Muscular Dystrophy Foundation had fired all of his supporters of the Muscular Dystrophy Foundation. If they even look like they like Jerry Lewis, they fired them all. And the telethons.
Wow. So wait a minute. You noticed that you were in contact giving him info. He was suddenly gone. Yeah. You called her back, and she confirmed that.
That's correct.
Good Lord.
Yeah, so I've talked to her many times. I've probably talked to her a dozen times over the last year, again saying, look, we're not looking for any money from the Muscular Dystrophy Foundation. We just want to give Jerry the opportunity because we're going to have a huge announcement coming out here in a couple of months. Cystic fibrosis announcements are coming out as we speak very quickly in the next couple of days. We know the cause prevention cure. We've actually known it for 35 years, but I'm starting to get the reversal of the genetic markers, so there's no doubt about it. And these are independent hospitals on hospital letterhead. They're freaking out because they couldn't believe it was possible, and they retested it, and the retests were better than the original test. And so they're very excited about this. That's for cystic fibrosis. Now, muscular dystrophy is the same thing. And even kids who've been in wheelchairs for 20 years, they get up and walk. Kids who have had it for 2 or 3 or 4 years who can't stand up longer than a minute or two, they fall down, are now playing basketball, and they'll knock you down to make a point.
But that's just like scurvy. I was even reading in mainline literature that a lot of times the hospitals won't test for nutritional deficiencies. Your teeth are falling out, your skin's falling apart. They don't ask, hey, you're drinking nothing but Coca-Colas and eating Doritos all day or eating Cheetos. You're starving to death. It's not, explain empty calories versus nutrients.
Well, empty calories, as you point out, Alex, are like bread and grain that's actually grown in soil that only has 3 minerals. And as you pointed out earlier, plants only need 3 minerals: magnesium, phosphorus, and potassium. Everything else the plant needs, they get from the air and they get from the sun's energy. Everything else they need, it's amazing that plants are able to do this. And so we need 60. So if you're eating a pretty good slice of organically grown bread that's multigrain bread, you could be 57 minerals short, because the plant only needs 3, and you can't tell by looking at it whether it has 3 or 18 or 12 or 10 or 6 or 20 or 40. You can't tell by looking at it because it only needs 3. We need 60. And so medical doctors only have 30 minutes of nutritional training and 14 years of medical school, and they don't get a test on it. So most of the time they're off in the bathroom smoking pot when that 30 minutes is given because they know they're not going to get tested on it. And then they teach dietitians and nutritionists what they know about nutrition, so 50% of nothing is not much. Where in veterinary medicine, nutrition is everything because we don't have insurance. And that's the reason why we've cured 900 different diseases in animals. Think about it, Alex. 60 years ago, an old dog was 8 years old. Today, an old dog is 25. We've eliminated 900 different diseases in dogs that still plague humans. We've eliminated every birth defect you can name by putting all these vitamins and minerals in a dog.
Let me stop you. I bought, because I saw that we had this, so we went to the vet the next time, one time to the vet, the other time to the Pet Smart place. None of the toothpaste for dogs had sodium fluoride in it, and I meant to bring that today and show you. Well, why don't we need the poison sodium fluoride for dogs?
Because, well, a dog only needs about 300 micrograms, about 1/3 of a milligram of fluoride to keep his bones hard. We only need 1 milligram. Well, between what the government puts in the water, between what you find in toothpaste and mouthwash, and the dentists paint the kids' teeth with it, and you might get a little bit, if you're lucky or unlucky, depending on how you look at it, get some natural fluoride out of your own drinking water, you could wind up with 25 milligrams of fluoride, which, again, can be, in fact, toxic. And so we're just getting too much of a good thing in that case. You only need 1 milligram to have healthy bones and teeth, and we know that in dogs. We control everything in dogs where we don't control everything in humans.
Dr. Wallach, who, as you know, is a top retired brain surgeon, developed many of the surgeries. He's concurred with some of the analysis you've had. He says it is a continually inflamed brain from all the toxins, chemicals, MSG, but more importantly, the statin drugs literally are disintegrating the brain. That's what he says. What do you say?
I say he's exactly correct. I've been saying this since 1971, Alex. Alzheimer's disease is a physician-caused disease. You get put on a cholesterol-restricted diet. You're eating egg beaters instead of eggs. You're eating boneless, skinless chicken breasts. You're eating tofu instead of red meat. You're eating margarine instead of butter and cream. You're getting on cholesterol-restricted cholesterol-lowering drugs like statin drugs. You're going to get Alzheimer's disease as sure as there's gravity. And so every baby boomer who was born between 1946 and 1964 will get Alzheimer's disease if they don't get off of statin drugs today. And that's why we have Alzheimer's disease, because 75% of our brain weight, Alex, is myelin, this white matter of the brain, the insulation material of the brain. And myelin is almost 100%. It's like 99.9% cholesterol. So you don't have the raw materials in a cholesterol-restricted diet, and when you're taking statin drugs, you don't have enough raw material just to maintain your brain.
They're talking about, and people think I'm joking, folks, pull this up. They want to put statins in the water and make 3-year-olds take it. Now let's move to government-run health care. In my gut, not just intellectually, I've never been more horrified. The IRS is going to enforce this as a tax to the insurance companies, hospitals, and doctors. They say that in their own words.
That is correct. And you know that they've hired like 7,500 new IRS agents to deal with Medicare and Medicaid and to deal with the money coming in, all this new money coming in from the affordable health care thing, a.k.a. Obamacare. This is going to be the biggest hit on the middle class since the Great Depression. It's going to be awful. And what scares me, Alex, is there's not a single thing they're doing in all this change in the medical care that does anything for the patient. All it does is tax people to get money to pay the insurance companies and the doctors.
Take your Jerry Lewis thing, and I want you to continue. You
Yes.
never hear about find the cause of breast cancer exploding over 2,000%. It's always find the cure. That'd be like if people were getting shot in their homes at night, they'd say, find a way to cure bullet wounds instead of finding out who's shooting people on their beds.
Exactly the same. Very great analogy. Very well said. And of course, again, there's no law requiring doctors to cure you. And I think in the old days, before there was insurance, doctors, general practitioners, tended to be part of the family, part of the church community, and they really loved the people they were working with. They did everything they could to help them. Once insurance came on the scene, the primary motivation of the family practitioner and the primary care physician was to milk all of your insurance funds from your insurance policy. And once they couldn't get any more money from it, they said, well, medical science has done everything we can, that we can't do anything for it anymore, because they knew you couldn't pay them anymore. Somebody needs to go to jail over this, because doctors have actually spent their whole life learning how to get the money out of your insurance policy. Well, what I suggest is that people actually get a $5,000 deductible, a catastrophic care only health care insurance policy. It'll cost them, for a family of 5, $100 a month, $5,000 deductible. Put $100 away every month, or $50 away every month to build up that $5,000, and get on the 90 for life. Take our 90 essential nutrients, the 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids. And like a dog, think about it, Alex. We only take a dog to a veterinarian once a year to get a rabies shot, because it's the law. And dogs live to be 25 years old, and they don't get macular degeneration, they don't get arthritis, they don't get heart disease, they don't get diabetes unless you're feeding them table scraps and doing things that you're not supposed to be doing to them, and or they get hit by a car, maybe they have some trauma. The same thing would be true of people. I mean, I have not been to a doctor, with me being the patient for 64 years. I have never been on a prescription drug. If everybody was like me, Alex, doctors would be very humble. Insurance companies would be very humble, because nobody would be afraid of getting sick.
Well, all I know is the statistics. I mean, we lead the world wherever there's this new Western MD Rockefeller medicine in cancer, neurological disorders, degeneration of the bones, the list goes on and on, heart problems. I mean, The more health care we get, the more unhealthy we get. And I see the studies about how they have the worst food in a hospital. It's worse than McDonald's. I mean, I knew decades ago the Rockefellers, on record, took over these hospitals, made them tax-free, but to really profit. They don't teach doctors anymore. They're supposed to do a third of their care for free. They don't talk about charity care, so they want this government care. I mean, really, this is a medical tyranny. And it's the enemy. I mean, you can't get me near a hospital. Every week or so, someone I know or someone's wife or husband or one of the friends of my 7-year-old daughter, healthy guy, had a little bit of a back problem, went in to have a surgery, the MD told him, died of an infection. I mean, I was drinking coffee with this guy 3 weeks ago. They said, oh, have a surgery. Dead. I mean, it's incredible. It's just, well, there's one thing I'm scared of. That's a hospital.
Well, that was a cover article on this. Let's see, the May issue of AARP Bulletin. They said the most dangerous place to be in America is in a hospital. And the CDC, the Center for Disease Control, came out in 1998, Alex, and said, and that's the federal agency that tracks these things, and they said that medical doctors infect 2 million patients each year in hospitals, of which 90,000 die. And that's because they wear the same white coat. They never wash their hands. They never wash their butts, probably, pardon me. They wear the same shoes, the same trousers, the same pantyhose from room to room to room without cleaning up. They drag pee and poop and pus and blood from room to room with all the viruses and bacteria. They transmit these 2 million infections, 90,000 deaths, and nobody goes to jail. They all get a walk. We treat pigs better in a barn because it's a federal requirement that you disinfect your boots before you go into the next pig pen. Vaccines have a place when there's raging epidemics and 10,000 people are dying a day. It's worth the risk at that point to get a vaccination. Nobody should be getting flu vaccinations or childhood vaccinations today in industrialized nations like the United States. If they're fed well, they're getting their 90 essential nutrients. It supports their immune system. They practice good hygiene, wash their hands before they eat, wash themselves every day, keep their body count down of bugs. There's no need for vaccinations now. That was something that went along back 150, 200, 300 years ago, 500 years ago, 1,000 years ago, when vaccinations were actually first created. For smallpox is where the vaccinations were first created back in the African tribes thousands of years ago. And that was useful because their hygiene was terrible, their water was unclean. But because we have, from the standpoint of infectious organisms, our water is very good. Other problems, but from the standpoint of infectious organisms, it's germ-free. And so these epidemics are water transmitted and food transmitted epidemics. So if everything's clean, we don't need to have vaccinations.
That's right. As usual, you're dead on target from my own research, from all the mainline scientists I've had on. If you look at the Western world, by the 20s and 30s, we've pulled these graphs up before, when they start getting indoor plumbing, when you're not throwing your crap out in the backyard, excuse my language, when all this is happening, you see all these infectious diseases go way down. Then the 40s come and 50s and vaccines, and infectious diseases actually go back up. Not like they were, but they go back up. And then I saw in California, they're like, we've got to force whooping cough shots. We had hundreds of cases. And then you go learn the statistics. 60+% of the cases were people who were vaccinated, and the other cases were vectored by the vaccine. I mean, I saw where the Bill and Melinda Gates group vaccinated millions of kids for polio. They only had a few hundred cases a year in India still, and 46,000 got paralyzed. A bunch of them died. Excuse me, 47,000. I mean, whoa. And it's like, oh, well, it killed a bunch of them, but that's okay, and spread a weaponized polio. I mean, this is madness. And by the way, you mentioned AARP. They found AARP, it was worse than you said. Put it back up. Was it 1 in 7 going in the hospital are being killed by bad care, not by what they went in for? So, let's put that back up because I'm going from memory. It was just up there a few minutes ago. I mean, this is incredible. I mean, it's not hype. They know most of it's mineral deficiencies. AARP. Hospitals may be the worst place to stay when you're sick. And yeah, scroll down some more. One study of Medicare patients found that 1 in 7 died or were harmed by their hospital care. I mean, there it is. Boom.
And the U.S. Department of Health and Human Services came out in November of last year, and they said that medical doctors kill 15,000 Medicare patients in hospitals each month. And that included Andy Rooney from 60 Minutes and Dick Clark from American Bandstand. They both died of complications of, quote, minor outpatient medical procedures. There's multiple deficiencies that can actually make your body prone to allergies. And it could be everything from salt deficiencies, because salt is required to make stomach acid, and stomach acid is required for your digestive enzymes to work. And if you can't digest proteins down to the simplest of amino acids, you get large chains of amino acids called polypeptides absorbed. You get allergies to them. And when you start taking all these nutrients again, including sodium and chloride, it actually makes your digestion work better. You break these proteins down to the simplest of amino acids, and food allergies go away. And it can happen in weeks or months. It's just awesome what your body can do when you give it the raw materials, including sodium and chloride, two elements that are necessary for proper digestion and nerve transmission. And then you have deficiencies of things like selenium. Heart attacks, of course, and your defenses against all kinds of pollens, viruses, bacteria require selenium. Well, selenium is a wonderful thing that actually helps recycle glutathione, the most potent antioxidant your body makes your liver work better, your immune system, your spleen, all your lymph nodes work better. And you get a wonderful amount of selenium that's called selenomethionine, which is the perfect way to get selenium. Actually, the guy, Dr. Gerhard Schrauser, the guy who discovered in 1957 that selenium is an essential nutrient, actually helped us formulate this, so we got the selenium perfect. And we're just so very excited about that being in there. So once you get all these raw materials, your body is remarkable enough to be able to take in these raw materials and defend itself. It's just, you know, like a rebel. Say, just give me the bullets. I'll do my own fight. And so give your body all the 90 essential nutrients. And I get so many people who just are messed up with allergies. They become dysfunctional. And you get them on the 90 essential nutrients, get rid of some of the bad food, and guess what? All their allergies go away.
It's just amazing that the system obviously knows this but wants to keep it from people just so they can have us debilitated.
Yeah, that's when I ask my audiences, and I give my 300 free lectures a year, when do doctors make the most money, when you're well or when you're sick? They make money when you're sick, and there's no law requiring them to cure you when you're sick. Okay, and there's no law requiring them to teach you how to prevent diseases when there are preventions available. And so this is where, for our own protection, we need to know certain things. It's almost biblical. You know, my people are destroyed for lack of knowledge, right? And so it's one of those things where just by a little bit of knowledge, be prepared. Again, if everybody were like yourself and me, taking these things, I haven't been sick in 64 years. I have not been sick, Alec, in 64 years. And the only time I visited doctors is usually to their funerals. My wife saves me the obituaries when I come home. If it's timely, I visit their funerals and find out, you know, they're 36 years old.
Briefly explain that. Why do you call your syndicated radio show Dead Doctors Don't Lie?
Well, Alex, because the average lifespan of medical doctors, according to their own survey, which came out in every medical journal in America, 1999, is 56. And why would you go to a group of people whose average lifespan is 56 to learn how to live to be 120 in a healthful way? And when you sweat out more than water. Sweat is not water. It's all of the nutrients floating around in your blood. So whatever you might accidentally get from your food is being sweat out. The harder you exercise, the more of these nutrients you sweat out. You drink water to rehydrate. There's no minerals in there. And you drink something, you know, one of these energy drinks that have, or sports drinks that have only 2 nutrients in it, that you're 88 short. And so we actually have a sports drink called Rebound that has all 100 nutrients in it, and it replaces everything you're sweating out. And I actually did 1,200 autopsies on kids under the age of 10 who died of cardiomyopathy heart disease, which is the sudden death that these athletes mostly die from, which is a selenium deficiency. And I'm the only guy who's ever done 1,200 autopsies on kids under the age of 10, published in international journals in both English and Chinese. So nobody can doubt it because, you know, they had referees that checked everything out. And these are the sort of things that we can prevent in kids by simply supplementing them with these nutrients.
Dr. Wallach, thank you so much for all the time today. And I really appreciate you spending so much time. I know you've got to go. You've got to go give a speech here in just about 20 minutes or so. I know how many speeches a year do you give?
Up until last year, I was giving 300 free lectures a year, but it's going to be closer to 400 this year because several days a week now I'm doing 3 lectures a day. That does not count the radio interviews.
No, you're a workhorse. You travel all over the world.
Well, the war is on, and if we're going to save America, we need more people like Alex Jones. And so I'm just so happy to be associated with you, and I'll support you in every way I can because InfoWars team, with the information you're putting out, we will be able to save America. And I just can't thank you enough for all you do.